So first, tell me what the plan is with Express Scripts. Why merge with them?
Sure. So we're a global health service company. We're fortunate to have 95 million customer relationships around the world. As we look at all of our business, including in the United States, we see that still the number one need for Americans is to improve affordability and to do so in a very personalized fashion. Pharmaceutical services have quickly grown to about 25% of the overall cost equation, with specialty pharmacy being about 2/3 of that 25%. And about half of that is in the medical part of the promise. So it presents an opportunity to further improve affordability, also further improve quality, because in America, when there's a gap in healthcare, so evidence-based care is not followed, it typically ties to a pharmaceutical. So that's point one. Point two is it expands our distribution reach. There's a lot of ways in which Express Scripts distributes to employers, health plans, or governmental agencies that we don't. So it expands our distribution reach to touch more lives with our behavioral services, our well-being services. So improve affordability and personalization for our clients and customers, improve quality, and then expand reach or touch more lives.
And how are you going to increase affordability?
Yeah, so first, you always have to have a strong foundation. Cigna's delivered the lowest or the best medical cost trend in the industry 5 years running, and 2018 will be 6 years running. And we do so by engaging the individuals, trying to lower health risks, keep people healthy, and then improve the quality of healthcare that's delivered. Express Scripts has also delivered differentiated medical cost trends, so we're building off of strength, but the way we further build off that strength is further tighten and strengthen the relationship between an individual or patient with their physician. We do that quite well through our collaborative accountable care relationships. Two, use actionable information to predict or identify health risks before they happen. So a pre-diabetic before they become diabetic, a coronary risk patient before they have the heart attack, a high-risk maternity mom and help that mom go full term. That's how you improve overall cost and quality, and the combined capabilities as well as information enable us to do that even better.
And what do you think will change about the way that healthcare looks in the future?
I think the biggest change we aspire for, and as a company we're driving toward, is more personalization. So what do I mean by that? Typically in the United States, most healthcare is purchased, the programs are purchased, insurance and related services, through some intermediary, an employer, a governmental agency, and they do good jobs to try to get the right package for the benefit of individuals, but nobody's average. We're all very unique. So through information and through technological innovation, you get a lot more personalization to the coverage, to the modalities of communication, to the access profile that works best for an individual. So I think you'll see a lot more personalization of engagement from that standpoint. And secondly, for the medical professionals, doctors, as well as the manufacturers of devices and pharmaceuticals, the rewards need to be much more oriented around the outcomes and the quality than the consumption. So those are the two big changes we see and we're fueling and driving as a corporation.
And do you think it makes sense at all for healthcare to be tied to employers anymore, given how much our workforce has changed?
Yeah, so in the United States, greater than 50% of Americans today get their health service support through an employer. That is a manifestation from a long time ago, post-World War II, wage controls that existed. But we are where we are. Answer your questions, yes, I do. And the reason why is an employer actually has a vested interest in helping to keep their employees healthy and productive and present from a work standpoint. Two, the work site and the culture of an employer creates some mechanisms to engage an individual, ways to communicate, ways to provide on-site care, ways to provide peer support, program support, et cetera. So there's incentive alignment, there's culture you could pull against and support it, and then there's delivery mechanisms. So we think the answer is yes, and we have a ton of bright spots where we could point to employers that have innovated with us and we've innovated with them, and their employees and therefore their business is better off, and those employees' family members are better off because they're getting better, more comprehensive health care.
And what do you think makes America different? Why are we spending so much on healthcare? Can you point to one thing that, like our policies or something in America that is a problem?
Yeah, so our system is quite different, right? We're a global company. We do business all over the world, so we are able to see systems in the most developed OECD countries and developing countries around the world. There's multiple differences. First and foremost, the United States is the largest sick care interventionalist system in the world. We spend the majority of our money and resources addressing people once they're sick. We need to spend some more of our resources keeping people healthy in the first case and identifying people who are at risk of health events and lowering those health risks. Some other countries do that better through social service support, community-based health support, et cetera. Secondly, we have more specialists and more hospitals per capita than other OECD countries, and less primary care, be it OBGYN, pediatrician, family practitioners, and we need to moderate that a little bit to, again, help to coordinate the whole person on the front end. There's trade-offs in the way we've built our system. As a company, we've had a great success partnering with physicians through what we call collaborative accountable care relationships. We have 375 of which that are up and running with physicians and another 125 with hospitals, and working more comprehensively. But in a nutshell, we wait too long in terms of trying to fix somebody once they're sick, as opposed to engage on the front end and keep people healthy in the first place. That's where Cigna expands a lot of resources. Secondly, we spend a lot more money on the high cost intervention, as opposed to enabling the primary care physician, the geriatrician, the pediatrician to have more resources to help to coordinate care for individuals. And we have a different pricing scheme relative to some of our services, be they pharmaceutical or otherwise, versus other parts of the world.
And when you look at the opioid crisis, what do you think is something, what will help that? What do we need to do?
Yeah, in a way, the opioid crisis is first, it's something our country should be quite disappointed we allowed to transpire, because essentially we've systematically poisoned our population in a way in terms of the mass consumption of opioids. But if you step back, it's another example that reinforces we try to answer problems with interventions. So have a problem, have an intervention, as opposed to more comprehensively help individuals manage pain. So stepping back, we consume the vast majority of the world's pharmaceutical opioids for 5% of the world's population. That doesn't really make sense. As a company, we stepped forward about 2.5 years ago and said we're going to reduce the consumption of pharmaceutical opioids by 25% for our customers, working hand in glove with physicians to bring the consumption back to pre-epidemic levels. And we sought to do that in 3 years. I'm proud our company did it in 22 months. And now we stepped forward and said in cities around the United States, we're stepping forward with a pledge to reduce the rate of opioid and overdose-related deaths by 25%. And the way you do that is one person at a time and working hand in glove with medical professionals and community leaders. So to me, it's a problem that is really symptomatic of an overconsumption of health services unnecessarily, and not addressing the whole person in coordination with the physician. And the bright spot is when you work collaboratively with the physician and the individual, you could move the needle forward, and I'm proud of what our company did.
And how do you do that on such a large scale? Because like you said, it is a very one-to-one thing.
Yeah.
And how do you create an incentive to not just to reduce the number of prescriptions without hurting people?
Yeah, I know, a really important and powerful question. So when you're a large corporation, no matter what industry you're in, the risk is that you kind of come at things in a homogeneous way. We believe everything is local. All healthcare is personal, all healthcare is local. So we operate a very localized model, aided by global resources. So the engagement happens with the local practicing physician, with our physician leaders, talking hand in glove with those individuals. It comes with convening community leaders, faith-based leaders, employers, elected officials locally, because the solution in community A is different than the solution in community B based on the local orientation. And in fact, our strategy is go deeper, go local, go beyond. So we're quite serious about that localization in terms of the personalization, the engagement at the local level and trying to drive it, but it's with the clinicians, not to the clinicians, and it's with the consumer or patient, not to the consumer or patient.
And going back to Express Scripts, when you look at a merger and when you look beyond just the synergies and the business opportunities, what else are you looking for? What culture or management things are you concerned about?
Yeah, I think the culture is quite important because, again, we're a global health service company. We're not an insurance company. We exist to improve the health, well-being, and sense of security of the people we serve. We're a service-based company. So you start with a notion of purpose. What is your purpose? We're a publicly traded company, and we get that. We're a performance-oriented company, we get that. But you could also be mission-based. So looking at a culture that is market-oriented, commercially oriented, consumer-oriented, respect and understand the clinical community and want to work with others and partner with others. Second, a deep empathy and humanity. So I was with the Express Scripts team on Monday of this week, all day in St. Louis, meeting with colleagues, talking about, and there's a deep passion, a community-based orientation. When you have those ingredients and an open-mindedness relative to sustained innovation, success is possible. If you're not commercially oriented, if you're not consumer-oriented, if you don't deeply respect the clinical community, if you're not community-oriented, if you don't have the empathy and humanity in your coworkers, we have 47,000 colleagues, they have 27,000 colleagues. it's tough to be a service company. So that fiber is quite important, and both companies share that fiber.
Great. And you have a new book, The Courage to Go Forward. Can you tell me what inspired that?
Yeah, it's the only book, so it's not a new book. It's the only book I ever penned, and I was fortunate to co-author it with the founder of Achilles International. Achilles International is a not-for-profit that focuses resources on helping people, largely with disabilities, both physical and otherwise, set goals, pursue those goals, have support around them, and complete those goals. We've partnered with them for about a decade. I've personally been highly active with them for 8 of those 10 years. And there's some really powerful stories that we wanted to tell, their founder and myself in the book, around these profiles and courage of individuals overcoming phenomenal obstacles to set goals that many people would think are impossible, and then introduce a little recipe of how you pursue those goals, because you just don't will them to happen. And then we introduced this theme of micro-communities, how very small aggregations of individuals, 1, 2, or 3, could wrap around and support an individual in pursuit of that goal. So we wanted to tell the stories, because there's many stories in there. We wanted to introduce the recipe, and with an objective of helping people have the courage to set goals that they may think are out of their reach, and help individuals realize that you could change people's lives one at a time by activating in these micro communities. And lastly, the purpose is quite noble, because 100% of the proceeds go to benefit Achilles International and further that mission.
And can you tell me what a micro community is?
So a micro community, it's a term we made up, right? So what it means to me is, I'll give you a concrete example. A double amputee wounded veteran sets a goal of running their first ever marathon on prosthetics. Never ran a marathon before, they had prosthetics. Not a goal that seems achievable. 1 or 2 people wrap around that individual and do everything humanly possible to enable that goal to be achieved. They're going to pull from other resources, but the intimacy of those 1 or 2 people, and I've had the blessing and fortune of being that 1 or 2 persons many times, and seeing the power of that, and failure's not an option, and we're going to achieve that goal. And then the leverage effect afterward for that person who realizes that goal was achieved to set other goals in their lives. One of the gentlemen, the first person I ever guided, Matthias, he set a goal to actually become a police officer as a double amputee. Well, he had to accomplish all the able-bodied tests, which were largely deemed to be impossible. Failed multiple times along the journey. Today he's a Long Island police officer. So those are the powerful messages you want to get through. But the micro communities are essentially to instill the ability for 1 or 2 individuals to make huge change, and then the leverage effect of that.